This is my recap of everything that I learned in BSHS 430, Healthcare Quality and Improvement. A few things that I'll be going over are healthcare improvement and the model for improvement that accompanies it, PDSA cycles and continuous improvement in the healthcare field, patient safety, patient-centered care and the importance of that, healthcare leadership, and the triple aim. As for healthcare quality and improvement, the Institute of Medicine reported that 44,000 to 98,000 Americans were dying due to medical errors each year. We really need to take a step back and see that this is a really high number and that we should be doing everything possible to minimize the risk of dying due to medical errors. 6 key dimensions were developed to better treat patients. One is that care should be safe. We should avoid injuries from the care that is supposed to help them. People come to the hospital and to the doctor in order to get help and be treated in the best way possible. Second, the care should be timely. We need to reduce wait times and delays. Third, we need to have effective providence of appropriate level of service. And fourth, we need to have efficiency in avoiding waste of equipment, supplies, ideas, and energy. Fifth, care needs to be equitable. This is really huge in the United States, and that care should be the same for each person regardless of their race, their gender, their sexuality. Sixth, care should be patient-centered. Care that is respectful and responsive to patients' needs is defined as patient-centered, and we really need to have our physicians not be as self-centered and more focused on their patients. The model for improvement asks 3 questions. One being, what are we trying to accomplish? This relates to the aim of improvement. The second being, how will we know a change is an improvement? This relates to the measures of improvement. The third question is, what changes can we make that will result in an improvement? And this is related to the changes in our improvement. So what is the model for improvement? There are 5 steps in order to create a change. 1 being setting an aim. This would be a general statement that is time-specific and measurable. The second being to establish measures. You need to have quantitative measures that allow for possible feedback. The third step is identifying changes. You want to think of actions required in order to achieve the aim. The fourth being testing the changes, and this occurs during the PDSA cycle, which is Plan, Do, Study, Act, which I will cover later in this presentation. The fifth step is to actually implement the changes. You make the change the new standard process within your environment. As I mentioned in the previous slide, the PDSA cycle. So the P in this stands for plan. You first want to state the question you want to answer and then develop a plan to test that change and identify data that can be used to determine if the change is effective. Next, you want to do. You want to run the test on a small scale and then document the problems, collect and analyze the data that you have run. The third step is to study. You want to analyze the results and compare them to your predictions and determine whether or not the change is effective. The fourth step is to act. Based on the data and what was learned, you want to make a plan for the next steps. So say that your data was very inconclusive and you couldn't tell if the change was actually having an effect, then this is where you would act by taking a step back and determining what steps you can make in order to have that change be more effective. As for patient safety, I really learned a lot in this section. The first quote that you see on the screen says, "First, do no harm," and this is a well-known phrase. A lot of doctors and PAs and nurse practitioners, nurses will say this phrase, and it's shocking how often patients are harmed when they come in for medical treatment, and they're still seeing themselves harmed by the system and sometimes with serious, sometimes life-threatening consequences. The next thing that really stood out to me is how common adverse events are. About 1 in 10 patients experience an adverse event during hospitalization. Healthcare is complex. Technology is evolving. There's not always a clear answer. Patients have really complex cases and require complex care. There's never enough time with your patient. I really think that patient-provider time is crucial to one's success in their appointment, and there's never enough time to really get to the bottom of things, and I really feel like this is really detrimental to a patient's safety. The next thing I really took away was that blame and punishment are not solutions. Instead, we should really focus on improvement in measurement, transparency, continuous learning, and reliability. I sometimes struggle with the reliability piece of it, especially in my future as a PA. I really need to hold myself reliable if I make mistakes and be transparent with my patients so that it doesn't happen again. Another thing that I find to be really important is teamwork. As a member of a team, there's a responsibility to communicate effectively in order to avoid mistakes. And oftentimes we see doctors going off on their own and trying to do it all by themselves, where there's a team for a reason and everyone has to cooperate in order to make the patient the most safe as possible. The last thing I wanted to touch on was negotiation. There's collaborative negotiation, has both parties working together in order to find a mutually agreeable solution. Patient-centered care is something that I've really focused on this semester, especially in my healthcare communication class as well. And it's important to realize that patients have a choice to accept the medical advice being offered to them by providers and do with it what they want. A doctor, a PA, an NP can tell their patient everything that they need to know in order to put themselves in the best situation possible as it pertains to their health, but it ultimately is up to the patient to decide what they want to do with that information, and we must respect that as providers. The second thing relating to person-centered care is that there can be barriers to a patient's acceptance of medical advice, and we must also be respectful of this. The social determinants of health plays a huge part in this, and one's socioeconomic status, and we really must be respectful of this as we're caring for our patients. The third part I wanted to touch on is that working together to reach the ultimate goals of the patient with the available resources and social, religious, and familial acceptance. So person-centered care is obviously based around the patient, but it's also their family too, and we must respect their needs as well. Healthcare and leadership, I think, is one of the most unknowledgeable parts of healthcare, and people may think that healthcare leadership is the healthcare administration, the CEOs of the hospital, but it really is true that anyone can be a leader, no matter your position of power, and you can always make a difference in your healthcare setting. It's important to use logic and get endorsed and appeal to the emotions of others in order to be successful in your ways of influencing others. And a big part of leadership is listening. It's important to slow down and listen to the concerns around you and come up with ideas on how to address these concerns. And it's also important to gain the respect of others in your path to establishing change. And lastly, the triple aim. This is really important. And the three parts of the triple aim are improving the health of populations, improving the individual experience of care, and reducing the per capita cost of care. So first, all clinical care providers play an important role in improving the services that they provide in order to contribute to overall population health. So as a future PA, it's important to realize that me providing care to patients is going to help the health of the whole population. And next, improving the individual experience of care. Quality care is regarded as safe, timely, effective, efficient, equitable, and patient-centered. So this goes back to one of my first points in addressing all of those that relate to quality care. And lastly, reducing the per capita cost of care. Lowering the costs by increasing the value can lead to sustained health outcomes and decreased chance of readmittance. So, the best care that you can provide is the initial care, and hopefully, this will allow the patient to heal properly and not need more assistance later on down the line.